Assalamu alaikum. Okay, so assalamu alaikum everyone. Today we have Dr. Sharmeen Jahan, and she is a board certified child and adolescent and adult psychiatrist. Today we'll be discussing emotional well-being during this COVID-19 crisis. Thank you, Dr. Jahan, for joining us.
Assalamu alaikum. Honored to be here. Thank you very much, Brother Mahabub and UC Santa Clarita for arranging this right discussion and right time. And thank you for inviting me to participate in this discussion. And to my community, friends and families, we are all homebound. And I understand it's a very difficult time, but I sincerely hope and wish that you and your family are really doing wonderful, happy and healthy with the grace of Allah. So we're going to talk about some mental health aspects during this COVID outbreak. So before I do this discussion, I wanted to present some statistical information. According to WHO, in 2010, the global cost of all kinds of mental illness was $2.5 trillion, and projected increase would be $6 trillion by 2030. And we, mental health professionals, we know that suicide is one of the top leading cause of death after heart disease and cancer. So now we know that we are in a house, nothing much to do, but we are fortunate enough to have technology. And with this technological support, we are bombarded with a lot of information, news, and scientific data information. So I don't think I would be able to bring up any new information, but I will try to emphasize on the vulnerabilities and the resiliency factors for mental illness. So I'll talk about the resiliency factors towards the end of my discussion. So before I start, what are the vulnerability factors? Who are the vulnerable people are risk of developing any type of mental illness? So we are talking about this current acute condition. We are still not over with it. So during this acute condition, whoever are elderly population, 65 and older, people with chronic health condition or pre-existing chronic health issues, people with any type of mental health illnesses, first responders, and healthcare workers, adolescent and teenage populations. These are the high-risk people who are living in constant fear of getting this virus and having the diseases. And teenage and adolescent population, we know this is the vulnerable age to develop any kind of mental illness. So we'll talk about the resiliency later on. So let's talk about some historical information to help us better understand this current pandemic and what we learned from our historical evidence. So there are a lot of different pandemics in different time in history. So if we look at this history, we had Spanish flu, Black Plague, pneumonic plague in India, SARS, avian flu, Ebola in West Africa, and current novel coronavirus or COVID-19. So Spanish flu, it took place during 1918 to 1920, and it was one of the greatest world disasters during that time. And what happened, if we remember that world history, that was the time of World War I, and world was already in crisis, lack of leadership, discipline, lack of structure, lack of resources. And because of that, look at the slide, we lost 50 million population. So 5% population in the world died during that illness. What we learned, we actually didn't learn much during that time. So after that, around Second World War, around 1945 to 50, WHO, CDC, and public health awareness developed to help this public to tackle these communicable diseases and any other global pandemics. So psychological responses, if we remember that plague epidemic, plague was a communicable disease, and it exactly same like corona. It spreads through respiratory droplets and also rat flea. So people were fearful of contracting that disease. They left their country. They started having fear and avoiding all people around them. They started fleeing their countries, and it caused significant lawlessness. As we know, and we are currently experiencing, that fear and worry kills more than the diseases. So this is a picture, if you have the opportunity to look at the slide, this is a photo I took from the Observer during the Spanish flu time. So we are having the similar situation after 100 years now. So what are the psychological responses? Psychological responses could be individual, and it could be combined, like all together. So whoever is already sick and got the virus, that individual is having one type of reaction, and we together having another type of reaction. So let's talk about the individual who contracted the virus or who got infected, how that individual is feeling. And hopefully our family members are safe, but think about the healthcare workers who are really dealing with these patients, so they are high risk. So when they're contracted this virus, they're feeling really lonely, isolated, stigmatized. They're anxious of either fighting the virus, getting better, or falling into the severe consequences of dying and death. And they are dealing with and living with daily insomnia. They're also fearful of passing this virus to their family members. And the staff, meaning family members and their coworkers and colleagues, they're constantly having conflicts with their duties. They're constantly having complexity of caring their patients and also caring their loved ones in their home. So COVID outbreak, when it took place around end of last year, November, December, we found out this news around December 31st. After their epidemic ended, China conducted an online survey, and in that survey, if you could see, more than 1,000 people responded. And out of those 1,000, 67% of those responders are women, and they responded with various symptoms of mental health issues. Among those, depression, anxiety, stress, stigma, and PTSD were the highest. So look at this slide, 50% complained about depressive symptoms and 70% complained about some type of distress. So biological impact, this is the direct impact of this communicable disease, the disease, death, and disabilities. And psychological impact, individual level, and again, community or social level, national level, and global level. So we are trying to avoid, we are homebound, we are practicing social distancing, quarantine, and isolation. We are fearful of having the disease, but consequence of the disease, when it gets better, there is a high risk of developing full-blown mental illness among some vulnerable population. So again, it shows that fear of being destroyed by this individual, invisible organism, effect of quarantine or social distancing and isolation. So these are the typical symptoms I am personally encountering in my clinical work every day. You can see all type of symptoms, and probably our community members, you also probably feeling either one of these symptoms today, tomorrow, or maybe a few days in a week. Anxiety, worry, fear, concerns, uncertainty, frustration, loneliness, anger, boredom, ambivalence, and some people are excessively using drugs or alcohol and suffering from depression. So factors, what are the factors actually leading to this mental illness susceptibility? If we look at the evidence, the longer duration of quarantine is a high risk factor. We don't want to be isolated. Human beings are not any type of living being that can live alone, period. So isolation, loneliness, away from one's loved one is a high risk factor. The longer the isolation, it would be a problem. Any question? I saw a hand.
No, it's
okay. So lack of supplies. We remember that a month ago when we started this social distancing and lockdown phase through the government, we kind of panicked and all the stores ran out of essential supplies. And I think we are still continuing these phases, and many of the supplies are not available. So fear of infection, we are still dealing with it. Lack of information, are we getting the right information from the scientific societies or our community leaders or government leaders? So that is another question. So is it this quarantine, the social distancing is voluntary or mandatory? That is also a risk factor for our mental health well-being. And impact on healthcare worker, the longer it would be, there would be a burnout syndrome and further consequences. So again, we see that total, how individually we are coping with it. Either we are absolutely going towards being fully dependent on others, or we are losing control of ourselves. Diminished self-esteem, we are losing our self-esteem, our identity, our strength. Feeling imprisoned, feeling like feared patient, feeling neglected because we are not used to living alone. So no phone call, no text, no communication, not able to see our loved one. Many of us have elderly parents and family members. They're living in separate places, so we are not able to visit them or able to see and find out their well-being. So that's how it can create a huge emotional feeling of neglectfulness, frustration, and boredom. So these are the acute phases going on. And then when the acute phase would be over, there would be another phase we have to encounter, and that would be post-quarantine phase. And already we see the social stress, financial stress, and stigma will continue. So the question is balance between competency and panic. So if we understand human behavior, the brain behavior and brain function, These are the defense mechanism our brain has. We are given this defense mechanism to fight and survive. Pain is one of the defense mechanism. If we don't feel pain, we cannot protect our body. Exactly the same way, our brain has the capacity to respond to the unknown situation, uncertain situation, that is anxiety. Each time we are anxious, our cortisol level, our adrenaline level, these neurotransmitters in the brain and whole body are flowing in a high level of concentration than usual. Our blood pressure goes up, our pulse rate goes up, and some of the other symptoms we all are familiar is sweating, heavy breathing or deep breathing, restlessness, lack of concentration, fatigue, muscle tension, sometimes could be increased or decreased bowel movement, insomnia, so many different things. So these are actually the outward response to our adrenaline and cortisol level. And those two hormones are actually the defense hormones to tackle the panic. So how much is actually we need? That is individual variability. We are given that variability based on our genetic structure, biological structure, and environmental factors. So some degree, so what I wanted to say, some degree of panic and anxiety are physiologic. We need that to fight and think and function properly. But when the panic level, the anxiety level really go out of hand, we completely lose our capacity to think through and make the wise decision. So are we in that gray line between physiologic panic or anxiety and the pathological form of anxiety and losing control? So this is the time what we are seeing now. This is what we are seeing now. So remember a few weeks ago when everybody panicked, rushed to the stores, and whatever were there, we did not know what we need. So we kind of tried to panically collected and hoarded a lot of different, first aid, food, essential material. Exactly same thing happened back then. People were storing tetracycline. Now we are storing hydroxychloroquine, sanitizer, and paper, toilet paper, paper towels, so much, all this stuff. So again, so this is what I'm going to talk about, the resiliency factors. So resiliency factors, if we want to understand the resiliency factor, we have to know the individual strength, or we can call it the protective factors. So protective factors we can divide into many different ways: individual protective factors, family protective factors, the community level, and the national level or global level. So what are the individual protective factors? So please, audience, these are the important words I wanted to use and practice. If you could remember, that probably will be helpful to cope and deal with this stressful situation. So individual protective factors, to identify those, we want to know our each individual vulnerability. So if you are healthy, if you are in good health, that's the number one protective factor. Your pre-morbid or basic level of stress management, how you deal with stress in any given circumstances, that is called your coping skills. And access to the healthcare system, in another way, having health insurance, so that anytime we get sick, we would be able to seek help. And then other factors are like not having bad habits and good lifestyle. So having good health, good coping skills, access to healthcare system, and not having good health and good support system around you. A network of support system we all need. So these are the individual protective factors are very important to identify our own risk. Then the family protective factors. So this is a crisis going on. So we really understand and hopeful that each of our individual family would be able to minimize the emotional stress at this time. So be supportive to each other. Be supportive to your children. They are locked up for a month and more. They lost their identity. They lost their peers. So they're the vulnerable population. So if parents are working from home, some parents are losing their job, having financial stress, but I'm still telling and really assuring you to maintain a cohesion among our family members. Please try to minimize the family stress level. Then the community level, the protective factors, a cohesive community, a good, well-connected community, what we are doing here through our UC center, Unity Center of Santa Clarita. So we are creating this cohesive communication through our community supporters, community leaders who are trying to understand each family's needs, their difficulties, and their challenges. Then it comes the national level. And national level, this is important that at our national level, our leadership is very important. We want to get the right leadership, the truth telling, communication between the national leaders and the scientific communities, and what they are doing and what would be best for them to do is the best interest of our people and public in general. So if we understand this protective factors, then we would be able to practice that in our individual level, family level, and that probably will help us to minimize the risk of stress and all those mental health issues and disabilities. So again, this slide is showing cohesion. So post-outbreak, after this acute crisis is over, what would be our goal? Reconnecting, establishing this community, going back to our usual phase that we lost now. Delivering, and for those, what are the important issues? The delivery of accurate information and clarifying confusion. And that would be, again, coming from the right source of information, the right media, scientific communities, and convey empathy to each other and normalize the reaction, facilitating acceptance and mourning of our loss. So this morning, I'm sure we all read the news in CNN headline, one of our Bengali brother, 56-year-old, passed away due to this virus attack. Inna lillahi wa inna ilaihi rajiun. And I read about his family is very heartbreaking and tragic. So we know that many of our families in New York are actually going through this type of crisis one way or another. So our goal would be fostering and facilitating the hope and initiate and integrate this learning among ourselves. So what I can say at the end, if we can look at the slide, is every hand that we are missing and not shaking becomes a phone call that we need to place, and every embrace that we are not doing now should be a verbal exchange of warmth and connectedness. So my last talk would be like we still need to maintain the social distance until this crisis is over, but maintain this emotional closeness to support each other forever. So this was my my slides. I just wanted to give you an overview what is going on around all of us and how we can prepare ourselves at this time and the futures waiting for us to tackle.
Thank you so
Thanks.
much, Jazakallah, Dr. Jahan. That was a really great topic. You covered a lot of things that I'm sure are very helpful to our community members. We actually have a question in our group. So they're asking what steps do you suggest for reducing the impact of COVID-19 related to anxiety and depression for Muslims? The concern is Ramadan is approaching and we won't be able to participate in activities at the masjid like in the past. And for example, like Jummah, we haven't done in a few weeks. So do you have any suggestions for that?
Again, this is a biological disease going on. So our first goal is to protect ourselves and prevent disabilities and death. So we want to respect our scientific communities and follow their guideline and protocol from the reliable sources, WHO, CDC, and our local health department, the public health of Los Angeles. So we're going to follow their guideline, and under this guideline, I think we are still doing this social distancing, and for some people, quarantine for 2 weeks or longer. So we're going to maintain that until an information comes that how can we loosen up this social distancing when we are ready to go back to community and mingle with each other. Until that time, I think this is a great opportunity with this technology that we still can maintain communication, our practices, our religious practices, our academic practices, social practices. So this is a great opportunity. I think that we would like to take these advantages of these upcoming days in Ramadan that we can do virtually, the Ramadan iftar prayer, iftar and Maghrib prayer. If we can do that through our UC center, I think that would be great. Until any scientific society okays, I would say we need to maintain our safety protocol.
Okay. Yes, that's definitely very important. And so another follow-up question on that. So if families are independently quarantining themselves for 6 weeks or more, can they visit other family members that are older?
Again, see, at the beginning of my discussion, we talked about vulnerability, and this is a novel virus, right? The coronavirus. Why we are saying this is a novel virus, and we are every day in like huge research is going on to really understand this virus physiology, the virus behavior, right? And many people are dying not only because of the acute respiratory failure or acute illness. Some of the people are getting better, they're released to their home, but all of a sudden they are collapsing. So we don't know this virus is causing the complications in other organs. So, but the vast number of population are actually dying who are vulnerable population with underlying risk factors, elderly population because of their low immunity. So given these circumstances, I personally would do like virtual communication, FaceTime, video chatting, and maintaining this communication that we want to make sure that we are next to our elderly parents and elderly relatives while we are giving them assurance that look, hopefully things will be over and we'll be again reconnected. But until this acute phase is over and until we really know when is the safe time, I would recommend that maintaining a safe distance to avoid this virus contraction is really important. So saying that means that we really love our loved ones, but for out of love and affection and care, we want to maintain this safe distance, this physical distance.
Okay, thank you. So I had a question going back to how you brought up different mental illnesses, for example, anxiety and depression and certain symptoms that people might see. So for those that are struggling with, already struggling or will like continue to struggle with mental illnesses, people who either receive therapy or medication, are there are there any ways for them to obtain professional help during this time? Because sometimes they go to like a medical office or a group facility. So is there any suggestions in that?
Absolutely. Okay. So people who are already suffering from various type of mental illness, so they need to be really vigilant, like changing of their lifestyle, the changing of their symptoms. Let's say people, their sleep cycle changes. They're either sleeping excessive or they're not able to sleep at all. Their appetite changes, body weight change. Because of their appetite change, they're either losing weight or gaining weight. Some people are constantly pacing in the house. Their communication with their family members decreased. They're not talking. They're isolating themselves in their room. They're probably just, sitting there, sitting in the couch with the phone, but actually they're not doing anything. They're not looking at any page. Their mind is blank. So when you call them, their response is very vague or blunt or like, very equivocal. So they're not actively participating in with the other family members. So these are the red flags of those people who are already dealing with some type of anxiety, depression, or other mental illnesses. So as a family member, their other family member should be more vigilant, more supportive, and let them understand that you are with them. And also, like, make sure if someone is on medication, make sure they're taking their medication the right way they're supposed to do. They're following up with their counselor or the doctors they're supposed to do, and they're not neglecting their physical health, their daily routine. So these are very vital. Your other question is where people can go to seek help or any type of advice. So there are a lot of information. The largest mental health organization in LA County is Department of Mental Health, DMH. It is state-run department, county-run department. This is the largest mental health organization. Millions of people get support. So if you go Google that website, they have 800 number. I don't recall that number now, but it's very easy to find. And they have hotline 24/7. You can call them, someone is there live. And you have any type of questions, where to go, how to seek help, they will provide you the direction. Remember, this is a communicable disease going on, and we are trying to avoid hospital visit, urgent care visit, emergency room visit. So this would be the first-hand information that you feeling any kind of distress, your family member feeling any kind of distress, which is more than usual, more than the capacity to deal with, please find out the 800 number. Or if you have your medical office already, you have your designated physician, you give a call to your physician will link you to the appropriate counseling department or the mental health department. So what we are doing now, because of our mental health practice, we are doing mostly video conference. We are not bringing patients to our clinics, not to have any kind of physical face-to-face evaluation. So we are doing video conferences, and this is completely approved by all the insurances and Medical Board of California and globally. This is approved. So there is no HIPAA violation. There is no kind of like, you're gonna get the appropriate kind of quality of treatment and guidance. So please do not hesitate that, okay, this quarantine will be over and after that I'll go. So this is a very important time. If you don't feel good, give your doctor a call, give your counselor a call, or find out that 800 number I just provided you. You can call anyone. And also on the community level, I can share with you, there are a lot of hot number and help number we created, like Bengali community, we created 1-800 number, and evening time, anyone without any health insurance or any other medical support, you can call that 800 number and you will be you will get initial screening and preliminary support and guidance what to do next. So these are the resources available at this time.
Okay, thank you so much. I'm sure that's very helpful to a lot of people. And you had mentioned earlier that this lack of structure for a lot of people, for kids that are staying at home and just playing video games or not being productive. I know that a lot of the schools, well, all the schools in our city are now like doing their coursework remotely. A lot of the workplaces are using Zoom and other platforms to work on projects or basically get the work done. And so I think this can be quite challenging for a lot of people because some of them, they're not used to working from home or doing school from home. And so this lack of schedule, like for example, if you're going to work every day, you get up, you get ready, you physically go somewhere. This lack of schedule isn't really, like, it's not present when you're at home. So I think it's very difficult for some people to find themselves to be more productive or achieve that same standard or the same goal as they would have otherwise at school or at work, whatever that may be. And they may be experiencing that burnout that you were mentioning earlier. So how can they avoid that at home or create like a structure for themselves at home to replicate what they would get elsewhere?
Thank you so much for your wonderful question. So this is my my area that, my interest, actually, I can share with you. My interest is, adolescent and teenage depression, anxiety, and psychosis. So that is my interest. So adolescent and teenage population, who are those people? From 10 to 18 years of age, right? So this is the prime time of our life. It's a wonderful life in human being, right? We are given this wonderful time. So why this is wonderful? Body is developing, hormone is flowing abundantly, and brain is developing. So brain development can continue until 25 years of age, but most of the development is done by 18 years of age. So that's the cutoff age of adulthood. So adolescent and teenage, in psychologically, we call it a period of peer relationship, identity development, who we are. That's the phase we go through at that time. So during that time, parents are passive. Parents are completely not important in their life. Who are important? Their peers, their friends. They want to build up that trusting relationship, that dependable relationship with their peers. And think about them going to school in social network and connection. So most of their time, every day they spend school, and we completely lost that connectedness. And I'm sure many families do not have multiple computers, multiple electronic resources. And also there are siblings, maybe one in first grade, one in fifth grade, another one is 10th grade, and they're all doing homeschooling, that parents are not capable of providing them the technological support. Parents are also working from home, so they are not able to supervise. So teenage kids, they're falling through this crack in last 4 weeks. They are cooped up in their room. They are not able to connect the way they used to. Their friends are not available when they are ready. So they are completely lost and connected from their identity, their relationship, the trusting relationship. Who they are leaning to? The parents. Parents don't have time. They're juggling with financial stress. They're losing job. They don't know that tomorrow their job is there or not. Economically, they have to struggle to pay the mortgage, pay multiple bills, millions of bills here and there, taking care of families back home. They're also at risk of this COVID-19. So these teenagers are cooped up in their room many hours a day in last 4 weeks. They're not sleeping enough. Their sleep cycle is completely erratic. And we don't know many teens what they're doing with that device in their room. So that is a red flag. Many teenage population without this supervision are going in a downward direction. Okay, so we have to be very careful and sensitive to their time and not be very reactive. So as parents, what we can do, no matter what we are doing, my job is busy, yes, I have to pay bills, but my kid is very important. My child's life is, this 14-year-old's life is ahead of the child. So I have to protect and save that life. So in between my work, in between my struggle and stress, I need to check with my daughter or son what he or she is doing in their room. Try to avoid closed door. Keep the door open. I understand their privacy, but do not lock the door. Keep the door open. Every hour, check with them, texting and going to their room. Make sure that parents are on board, that we are working as a team. And then the routine. Then they are doing homeschooling. That's understandable. So kids are very, kids understand. If we talk at their level, so they will understand what is going on. By this time, these kids are very smart. They have a lot of information, more than we know. So talk to your child at his or her level, cognitive level. Help them understand. So we want to be tolerant with each other and help them understand that the sleep, 8 hours sleep is very important. If we continue to have this lack of structure in their life, it's gonna become very difficult to undo when things become normalized. So bedtime is very important, not too late. Wake up in a decent time by 9 o'clock in the morning. That's the time brain is very fresh. Make sure that child is having balanced meal and nutrition, not the junk food, not the high calorie food, okay, because they get quickly filled and then, they don't really eat properly, which is like, right? Balanced meal is very important for them for balanced development. And then exercise. Yes, they are sitting home, but they can do some kind of exercise while they're home. And I see some schools are implementing that through online, their physical activities. They can still take a bike ride or take a walk or go to the park while they are maintaining safe distance, safe social distancing, not contacting each other while we are still dealing with it. So these are the recommendations. I believe in this and strongly advocate for healthy development of all these teenage and adolescents.
Okay, thank you. You had mentioned, for example, the parents to be a little more involved in this case with these teenagers and young adults. One of the things, for example, for parents, for a lot of people that do have the responsibility of making sure that their kids, that their children go through the school, like complete their homework, complete their assignments on time. So be on top of that, plus do their work from home. This could create like a lot of stressors and additional stressors that they didn't necessarily have before. So would you have any suggestions for how they can deal with these stressors at home and kind of minimize them and cope with them in a healthy way?
Okay, so as we discussed earlier that, we are all stressed, individual, family level, community level, national level. So we kind of could be neglecting and ignoring each other, right? We are neglecting not because that I neglect you or I don't care about you. Because my stress level is so high, I am not interested in, asking you how you are doing. So that is a natural type of phenomena work in individual level, family level. So when the parents are really dealing with their own struggle, the adult struggle, financial struggle, job, and other responsibilities. And if the parents are already going through depression, anxiety, insomnia, parents lose the interest to ask, and they kind of feel, okay, you know what, this is the time they're going through this. Okay, that's okay. Grades are not that great, but we understand. So at this time, given this crisis time, so let's focus on how much a child can do. Does the child really need to get A plus? If your child is really an A plus student and he or she is maintaining that, that's totally great. But if the child's grade drops during this given time, that's okay. Remember, the child is also struggling. He or she is coping with this lack of normalcy. They're stressed out. They don't like it. They want to go out and have good time with their friends. So if that grade drops, that's okay at this time. And see all the school districts saying that, okay, this semester grades are not going to affect your grades that much, right? So that's a comfort. So try to give them the signal that, okay, you try your best, rest is on Allah, right? So we're gonna try on individual level, as a team level, we're gonna try to help each other. So when we are stressed, remember other thing, we talked about cortisol and stress hormone. If we are on constant stress, that will gonna suppress our immunity, and children are also vulnerable. So whenever immunity drops, we are vulnerable to have any type of biological diseases, and respiratory disease is the very quick one to get. So if we can maintain their stress level, that children are not that stressed if their grade drops a little bit, but you are providing them a well-rounded quality of life, that yes, my child is eating properly, yes, my child is sleeping properly, my child's mood is not that cranky or irritable. We are trying, everybody's trying to maintain a balance. I would say that's good enough. So let's pass this crisis time, and then we're gonna review and look over the grades.
Okay. So you had mentioned earlier that regarding social support and social communications for both adults and uh, children and teenagers. So a lot of younger, I'm focusing this question on younger children. A lot of younger children, they're enrolled in sports, for example, like after school programs, clubs, things like that, where they built up, you mentioned like self-identity and self-esteem. And so without that, that kind of went away all of a sudden with school, with their friends, with their peers. So at home, would you suggest like activities that they can do with maybe their parents, or something that they can do in replacement of those activities?
Absolutely, yes. Okay, so what are the things you can do now while we are sitting home? This is difficult, yes. We are not used to that, but look, take the advantage of this technology. So many of my teenage children who come to my clinic over last 1 month, my job is to check their daily routine, what they're doing. So this is my job I do. Are you sleeping 8 hours? What are the activities you're doing? My most common answer I hear, they're playing video games 8 hours, 9 hours, 12 hours a day. So that is very alarming. So, and they're doing it more often, and parents are thinking that, okay, this is an unfortunate time. I'm not gonna say anything, let the children play whatever they like to do. But actually, 4 weeks, we passed 4 weeks and we're going towards even longer duration. So it's going to become a habit, and we might lose our children, connection and bonding between parents and children. So take this advantage, find out some time, a family time that parents and children can do together. Quality time is very important. This is not only for this pandemic or crisis time, this is in general for healthy development. Healthy nature and nurture. That's what we all talk about all the time, right? So if nature is there, but nurturing is not there, we're not going to be an well-rounded, resilient human being. So during this time, while we are sitting home, we can do like watching movie. Let the children pick up their favorite movie, a family movie that everybody can enjoy. And after watching the movie, maybe you can talk about that and you can connect with each other. Find out another game that we can do together. It could be board game or any type of game that the children enjoy. So take turns between parents. One day they're going to pick up something, the next day children going to pick up, but there should be some allotted time for each family every day. If not every day because of our duties and other responsibilities, every other day we should spend at least 1 hour as a family. And this is also like as Muslim, when we go to mosque throughout the Ramadan, this is such a wonderful time. We sit down together, we talk to each other, and children, they talk to each other, they make further bonding, they make new friends. So these pandemic times, this social distancing and home lockdown situation is actually causing a lot of good outcome. I hear a lot of bonding time that children are doing with their parents they did not do before that. So in another way, they are kind of like, out of their friends network, but they have no other choice but to come to their parents. So this is very important that we should spend some time with the children, not always be authoritative parenting or authoritarian parenting. Just check and have fun time, silly time, talking and giving them the assurance that, I'm not always watching you as a hawk, but I could be your friend. So this assurance is very important for them so that they will open up with the parents and share a lot of things they don't want to share usually.
Okay. Well, thank you so much for that. I know that would also be very helpful because I know a lot of people, they spend all day at home with their families, and I'm sure over time if there is like a lack of activities or whatever it is. So thank you so much for your suggestions. So right now I wanted to go ahead and open it up to everyone else and see if anyone else had any questions or that they wanted to ask regarding our topic today. So I wanted to ask in the meantime really quickly, I know you touched base on on children. So I wanted to ask specifically for young adults, if you could just go over that really quickly. I know young adults, they're kind of in that stage where they focus on work, school, and maintaining like relationships with families, friends. And so I know personally, I know a lot of people that are struggling with that right now with everything going on. It's just kind of like everything's just shaken up. So is there any suggestions that you have in terms of that? Maybe they're spending time with their families and they probably can't do the same activities as maybe their younger siblings or other younger children.
This could be a very broad term, and correct me if I'm wrong. These days, our pastime is on with the phone and electronics, right? So especially since you brought up this topic about the young generation, are you saying young generation like below 25, or are you including all the way up to 40 years old?
So I wanted to ask specifically for maybe college students, so below 25, I would say.
Okay, so they're still very young. Yes, so that this age is, this is the crucial, this is the fantastic time of our life. And again, identity development continues all the way from 10 years of age to 25 years of age. So this is the like identity versus role confusion. I learned it in psychology. And next phase would be love and intimacy. So even though love and intimacy is coming from 25 to 30 years, 35 years of age, but a lot of their talk about relationship development, the trusting relationship, the good relationship development. And that relationship has to be like, opposite gender or good friends. It could be any type of trusting relationship. So that is very important. So these days, people are really spending a lot of time virtually. And there are a lot of statistics coming, NIMH, National Institute of Mental Health, American Academy of Child and Adolescent Society, American APA, American Psychiatric Society. So there are a lot of publications, even Lancet came, that people who are spending excessive amount of electronics, unproductive electronic time, that is causing the similar type of reaction the brain get used to when brain gets a drug or alcohol. So drugs and alcohol, what we take from outside, what is doing to our brain? It is causing a huge surge of dopamine. And dopamine in lay term, you can say like, reward hormone. And the whole world is driven by dopamine. So dopamine is the reward hormone. It gives us the excitement, stimulation, happiness, everything. We go on shopping, we get happy. Why? Dopamine is releasing. We go to a feast, we see good food, dopamine is released. So eventually, when people like, for instance, when someone is using cocaine or drugs or any type of alcohol, so immediately there is a quick gratification, or even sugar. When you're drinking a Coke, there's a huge surge of dopamine. The surge of dopamine depends on what we are taking. So concentration dopamine depends on that. The highest concentration comes from cocaine take, and that's why it's very popular among the users. So what happens in brain? As you continue to give this trigger from outside, the dopamine cells are destroyed. Brain loses its capacity to produce more dopamine. So cells are diminished. So when dopamine is completely down compared to the normal level, normal concentration, then we get into the depression level. So it's very connected. So playing video game, engaging ourselves in recreational screen time, like social media, Facebook, networking with friends, which are not like, after 1 hour, 2 hours, what do? We just continue to browse and see what other people are doing. So when we keep doing the same things, initially it is rewarding, and gradually we lose that reward, that kind of excitement. Nothing is making me happy, or it's not new, so I'm not getting excited. So gradually we lose that excitement. And the more time you spend on the unproductive electronic use, it is actually the same phenomena. It's bringing depression. So I told you, I shared with you the evidence from the articles, the recent research are done in many different European countries, even here in America. So many people who are excessively spending online, electronically, internet use. So there is a term called internet addiction, online addiction. So this is the same phenomena like video game addiction, that you are completely depleting the dopamine level, and you are going to a phase of depression that it takes long time to recover. And most of the time, it needs some professional intervention. Okay. So back to your question, a balance between virtual life and reality is very important, because these millennial people, this is a new technology. Facebook is in the market for last 15 years, and all the social media development in last 15 years. Before that, we had a lot of physical connection, phone call. So phone call is like gradually getting, decreased. These millennial populations, they are comfortable texting each other. They don't use their voice anymore. So what would be the long-term outcome of this huge internet use? We're going to see in another few years to come. So saying that means that the younger population, the younger generation need to really understand this human brain function and balance between the practical life, the physical connectedness, and virtual connectedness. So this COVID-19, this pandemic is actually teaching us the intensity of lack of connectedness. Lack of this connectedness may destroy human civilization. Are we going into that direction? We don't know yet.
Okay. Thank you, Dr. Jahan. I really appreciate your answer. We do have another question. It's regarding the sleep schedule that you had mentioned, that this is changing amongst children. And so now that their friends are staying up at night, connecting with one another, the question is, what is your advice on that?
Oh, my 90% children in my practice is they come, children, adolescents come with their parents with the complaint of attention deficit hyperactive disorder. I'm sure you're familiar with that, right? 90% of the teen and adolescents. So out of 10, 3 children already taking medication. Out of 10 children, 7 children are complaining about some degree of poor attention, poor focus, impulsivity, and consequences of poor academic function and other functional impairment. So without ADHD, without any type of physical health problem or emotional health problem, we also get a huge number of children and adolescents come with insomnia. Why a child, a healthy young individual, is going to have insomnia? This is very unfortunate. And we did not have these complaints 10 years ago the way we get now. The percentage is huge. Why is that? Before we complain, we need to really understand why many children are complaining about insomnia. So sleep, before you talk about insomnia, sleep is actually a symptom. It is not a disease. So sleep could be impaired because of medical issues like chronic pain, cardiac problem, respiratory problem, cancer, any type of chronic health issues. People cannot fall asleep or maintain sleep. Sleep could be due to drug use, sleep could be due to substance use illness. So these are the major 2 causes, and sleep could be due to other mental health illnesses. So this is a vital presentation. If a child comes, unfortunately, I encounter so much and it breaks my heart. Why is that? Because children are not maintaining sleep hygiene. Parents bring their children to us to fix this problem. But this is not a problem that physician or counselor need to fix. Parents need to be more vigilant. And the sleep hygiene, we call it sleep hygiene, should be a practice. Whatever we practice, it becomes a habit, right? Mm-hmm. So, and brain is the most, like the vital organ in our body, is the highly adaptive organ. The way we train our brain is gonna go that way. So these children, days after days, they go to their room, parents think they're falling asleep, but they're sleeping with their phone on vibration, or they check what the friends are texting, then they wake up, check, keep back and forth. And when they continue to do it for several weeks or months, they don't sleep. And many kids, they say, I fall asleep in the classroom. So are you not sleeping at night? You dig into that question and really get to the bottom. The answer we know, yes. You are checking your phone, you're texting your friends, and you don't want to go to bed. You play video game after all the homework and stuff like that. And there is also teenagers' identity development and the the freedom that I am going to be an adult so I can take care of myself. But actually, if you don't take care of yourself properly, then parents need to intervene. So saying that means that practicing sleep hygiene is very important. We all should, especially children. And another important factor I want to add on, the growth hormone. Growth hormone throughout the developmental phase until 18 years of age is released during sleep. So that will cause the height, weight, everything. So this is a very important time that children must get 8 to 9 hours of sleep. So sleep hygiene is going to bed every day, same time at night. Wake up, try to wake up at the same time. Do not keep your phone, electronic devices in your child's room. I'm sorry, I have to say that. And if we do not practice this healthy lifestyle, what we do? We quickly jump into the treatment of medication. Yes, it's going to be a quick solution, but it's not a cure. And it should not be that way. So sleep hygiene, healthy lifestyle, balanced meal are the key for good health and resiliency.
Okay, thank you so much, Dr. Jahan. I wanted to go ahead and ask everyone else if they had any questions. You can unmute yourself and talk directly. We do have just a few minutes left. So if anyone has questions, now would be a great time to ask. Okay, so if we don't have any more questions, I just wanted to say again, thank you so much, Dr. Jahan. These all have been such great advice, and I know that everyone in our community can benefit from all this information. So thank you so much, Jazakallah, and Assalamu alaikum.
Alaikum salam, Tasneem, thank you very much. Thank you, Brother Mahbub, for this wonderful effort. And hopefully some of this information would be helpful to some of our folks and our friends and families. Thank you so much.
Thank you so much, Ravi. This has been very helpful. Thank you.